start a second time, and maybe this time by introducing myself as with my full name. It's Thomas Henrichs. I'm the Deputy Head of Unit in the Unit for Clean Air and Urban Policy at DG Environment at the Commission. And I'd like to use the next 20 minutes to introduce you and update you on the air quality policy in the European Union as we are implementing it. So this will be a brief journey looking at how and why we still consider air pollution as a key environmental challenge, also for Europe, despite where we have arrived at already by now, and how the clean air policies that we have tackled this long-standing challenge. In many cases successfully, but not yet conclusively, as I can already say up front. And then I'll finish up reflecting with you on how we proposed and how we are now concluding the negotiations to update our policy efforts and what we are expecting to achieve by doing so. But maybe since I'm the first speaker of the day, I'll start with some basics. And that is the obvious that clean air is essential. So when we talk about air pollution, we are talking about gases or particles that we as humans, as a society, add to the atmosphere, primarily through burning fossil fuels, but of course not only. Gases such as nitrogen dioxide, sulfur dioxide, carbon monoxide, benzene are almost invisible. Also, the particles in question are so small that individually they can hardly be seen. The illustration that here I borrow from the EPA in the US hopefully helps drive this notion home. Take the width of a hair. You can fit 7 particles of what we call particulate matter of the size fraction PM10 across it, or 28 particles of fine particulate matter, PM2.5. And even many, many more if we also consider ultrafine particles that are also part of the discussion. And these particles themselves can carry, attached to them, heavy metals such as arsenic, cadmium, nickel, or lead. The reason I'm emphasizing this up front is that even if we can sometimes see air pollution, more often we cannot. But that does not make it less dangerous. It does, however, make it much more difficult to manage. So air pollution has been understood as a result of the dynamics of the pollutants I just described to be a key environmental challenge for several decades already. So we're not starting fresh. Several EU-level policy interventions date back all the way to the 1980s. They've been expanded in the 1990s and the 2000s and basically comprise 3 pillars. The first one on the top is the Ambient Air Quality Directive, which establishes air quality monitoring systems and sets air quality standards, meaning concentration levels for air pollutants that should not be exceeded anywhere in the EU. The second pillar on the bottom left is the National Emissions Reduction Commitment Directive, or often abbreviated as the NEC Directive, by which member states have agreed to limit their respective national total emissions of 5 air pollutants, PM2.5, NOx, SOx, ammonia, and volatile organic compounds. This is important as it reduces background concentration levels, and the pollutants in question are precursors that often react in the atmosphere to form additional particulate matter. The third pillar, equally important, establishes upper limits for key pollutant sources in transport, in industry, or energy, and includes, for example, the recently updated Industrial Emissions Directive, the Euro standards for vehicles, eco-design rules, etc. And in combination, the 3 pillars, these 3 different policy strands, deliver a air quality policy that reduces air pollution quite successfully. I'll illustrate this with this graph. Since 2005, we've reduced emissions of air pollutants across the EU by between 80% for sulfur dioxide, 27% for particles, and 12% for ammonia. And at the same time, we still have seen, fortunately, growth in gross domestic product, in this case by more than 13%. And the reason this is significant is to show that the reduction of air pollution does not come at the expense of our economies. And as you will see later on, quite the opposite. And These reductions themselves have delivered a significant reduction in the associated health impacts. The number of premature deaths, which is depicted on this figure, that are attributable to PM2.5, which is the key pollutant that associates current health effects, has dropped by 45% during the past 2 decades. And that means we're already now close to reaching the 55% reduction goal that we set ourselves for the year 2030 with the Zero Pollution Action Plan. So with this one graph, I'm trying to illustrate what we could do with several other graphs. That is that our efforts are paying off. So our investments in clean air policy are working. But at the same time, and that is the flip side of the coin, we still have 250,000 premature deaths attributable to this pollutant PM2.5 alone. And that's an annual figure. So this clearly illustrates that air pollution, despite its progress, is still a problem in the EU today. I showed the premature death numbers in the previous slide, but mortality is not the only metric for health impacts. Air pollution also causes very considerable morbidity effects, such as respiratory diseases, cardiovascular diseases, or asthma. Beyond that, it has a very clear established link, for example, to lung cancer, with the World Health Organization estimating that 17% of all lung cancer cases in Europe are due to air pollution. There are other diseases linked to air pollution. It also, in Europe, still carries social impacts, as we often see air pollution to be disproportionately affecting vulnerable groups in society. Children, elderly, persons with pre-existing health conditions, as well as often the socio-economically disadvantaged, are exposed or are suffering more from adverse health impacts of air pollution. Beyond the health aspects, we also have eutrophication and acidification of ecosystems, and even crop damage and forest damage that still associates with air pollution these days. And all of this, in sum, translates into a significant economic impact. Depending on how you assess the value of health impacts in particular, there are different metrics for this, the estimates of annual cost of air pollution for Europe still range between 230 and 850 billion euros per year. So all of this creates a need for us to continue and expand our air quality policy. And this is what the European Commission, as part of the European Green Deal in 2019, committed to, namely to learn from the experiences of the air quality legislation as it stands, and then to propose, based on this, to revise the current air quality standards to align them more closely with what the WHO, the World Health Organization, recommends. And also, part of this proposed already in 2019 to strengthen the provisions on monitoring, modeling, and air quality plans so that we can better manage air quality. And a good 1.5 years after that, we did exactly that. In October 2022, as was said in the beginning, the Commission put forward a proposal for a revised Ambient Air Quality Directive. This proposal was developed based on the better regulation principles, meaning that we underpinned this proposal not only with a policy ambition, but also with an extensive impact assessment. This was initiated early in 2020, and it included both a quantitative analysis of different policy options based on the leading air quality models at the European level, namely GAINS, EMAP, EUMAP, and GEM E3. But it also included a public consultation with close to 1,000 written replies, several rounds of expert consultations, as well as 2 stakeholder meetings, most of which had more than 400 participants, including, as I remember, several colleagues that I expect are joining us today. In other words, we listened very carefully to both the evidence and the different perspectives. And I will limit myself to some elements of the assessments today, but all the work that we have put forward is well documented and should be transparently accessible via our website. So the main question that was raised, of course, is when we lower our air quality standards, what drives this? So we've considered several policy options, and they are based on the updated air quality guidelines published by the World Health Organization in 2021. And this is a brief summary of the main pollutant this addresses. So based on their systematic reviews, and in this case for PM2.5, they identified that there would be a quantifiable negative health impact of concentration levels as low as 5 micrograms per cubic meter. And they suggest, the WHO suggests, to set this as the guideline exposure level. The WHO also recognizes that not all regions can achieve this in the short term. Therefore, they, alongside the guideline levels of 5 micrograms, also put forward interim targets at 10, 15, 25, and 35 micrograms. But they're also very clear that these interim targets come with an increase of mortality and morbidity, in this case of 4%, 8%, 16%, or 24% above what you would have if you reached the guideline level. We have taken those numbers as a basis for analysis of 3 different policy options. Note that the current limit value in the EU is still set at 25 micrograms, so that's the red arrow. So we calculated what would the impact be if we lowered that to 15, 10, or 5 microgram respectively. And this logic was then applied also to other pollutants, namely NO2 and others. And this, of course, resulted in a complicated, quantified assessment that I summarize here with one table, and I do not expect you to understand or dive into this table in detail. Those of you that would be interested in that will likely consult our impact assessment. What I would like to highlight here is that in our assessment, we came to the conclusion that all 3 policy options would outweigh the benefits, would outweigh the implementation costs. The table summarizes this as far as it puts forward 5 key metrics that allow a comparison. The 5 metrics here that you see are achievability, mitigation costs, gross benefits, the benefit to cost ratio, and the expected health benefits of each of those 3 options. To cut the story short, we opted for the middle policy option, so I2 at equivalent of 10 microgram for PM2.5, because we, for this, calculated that it would be achievable by the year 2030 based on EU policies without additional, more stringent local measures at 94% of the sampling points that we looked at. This number is lower, of course, than 99% of the sampling points that would be able to meet the less ambitious option, but strikes us as more achievable than the full alignment, the more ambitious option, which only 29% of the sampling points would be able to meet. The costs of these additional measures of the option that we opted for are estimated to be 5.7 billion per year, compared to gross benefits of 42 to 121 billion per year, again, depending on how you value human life. In other words, we expect with the policy option chosen that there is at least a benefit to cost ratio of 7 to 1, and higher if you are using different metrics to value human life. So this brings us all down to what does the proposal actually suggest to do? This covers 4 areas. The first one is environment and health. So we proposed a zero pollution objective to be met by 2050 at the latest. So this is a long-term outlook that is part of this proposal. To set us on a trajectory towards this, we put forward air quality standards to be achieved by the year 2030, which correspond to the intermediate policy option that I referred to before. In other words, for all 12 pollutants, we propose them to align them more closely, but not fully with the WHO recommendation. We also proposed an update of other air quality metrics, including in particular an average exposure reduction obligation at regional level. And we refer to a regular review mechanism to adapt the directive to more recent finding as time progresses. We also strengthened the governance and enforcement aspects of the directive because we put forward mechanisms to make air quality plans more effective, not only to stop, but also to prevent air quality exceedances. We proposed an improved enforceability with provisions clarified for access to justice, compensation, and sanctions. And we also expanded the cross-border cooperation on air quality. A third key element is improvement of monitoring and evaluation, which is also part of the announcement already done in the Green Deal. Therefore, we, in our proposal, include revised and further improved approaches to monitoring and an increased use of air quality models. In addition, we also strengthen the provision on what sampling points are representative for and what pollutants we measure beyond those that have standards, including ultrafine particles, black carbon, and ammonia. And lastly, we also strengthen the information and communication aspects, as we want to increase the availability of up-to-date information, not only on an annual basis, but hourly basis, so that we can communicate with a wider public using air quality indices and up-to-date information also on health impact. So this was our proposal. And in short, the agreement between the co-legislators confirms all of these aspects of the proposal in the direction and in many cases also in the detail. Of course, this proposal that has been agreed constitutes a compromise between the different positions between the Parliament and the Council. So effectively, it retains all the elements that we hoped to improve with the proposal. But I will not walk you through all the details in the fine print and invite you to look at the published version, which is available, for example, on the Council's website already. So what are we expecting to get out of this? First, we think there will be we expect a significant reduction in the particulate matter concentrations based on the assumptions already in the baseline situation, as we would expect additional measures. This map shows the model situation for the year 2020. Everything that is red, and there's still some spots, is above the current limit value. Everything that is blue would already be below the proposed limit value. And the yellow areas are the zones above the proposed limit value. I should say that this map also includes natural air pollution, which is, according to the agreement reached, to be deducted from any compliance assessment. For 2030, then, we expect a significant improvement. The light blue area clearly dominates in the 2030 projections, but I should be clear that this resolution that I use here distorts the picture slightly, because as I mentioned before, if you zoom in, you will see that 6% of the stations remain above the limit value, not only in the Po Valley, but also in other hotspots in most countries, related to both road traffic and domestic heating, but also to shipping and ports. Therefore, and this is important, we allow in justified cases for a option to have transitional periods and extensions, and according to the agreement reached by the co-legislators, this in some cases can be extended up to the year 2040. So to summarize this, we expect that this revised legislation would bring health benefits, social benefits, environmental benefits, and economic benefits that we've quantified. For health benefits, we calculate a reduction in premature death and health impacts more generally by more than 50% than what we would do without this proposal. We expect that this will in particular benefit people at high risk, as we are looking to decrease high concentrations in particular. We expect environmental benefits, both a decline in eutrophication and acidification, but also reductions in crop losses and damage to forests. And we expect, as I mentioned before, significant economic benefits. I mentioned before the numbers that we would see annual gross benefits in the order of magnitude of 42 billion to 120 billion compared to measures costing less than 6 billion. So my final slide, I would just like to highlight 5 overarching reflections. First, and this is most important to stress, that EU policy, clean air policy, works. So we've seen major improvements in air quality since the 1990s. And this is important as it means that our investments in this policy area, which in many cases have been taxing, have paid off and will continue to pay off from a health, social, environmental, economic perspective. In other words, it just makes sense to invest in equality policy. The second point is that we are pretty aware of what we're doing. We have a air quality monitoring network of 4,000 plus monitoring stations across Europe, and air quality modeling that increasingly provides us with exceptionally robust, comparable, and harmonized information. This is maybe trivial, but it puts us in a position that we as a society are pretty well informed about air quality in a reliable manner, and also in what works and what doesn't work, and by now even in real time. The third point is that the revised Air Quality Directive, when adopted, will of course, and I stressed this in my previous slide, render significant benefits. And fourth, yes, there are still regions in Europe that face a challenge with the current and are expected to and will be facing challenge with the future air quality standards. But even in those regions, despite the challenge that they face, we've seen striking improvements in the recent years with very tangible health benefits. And finally, it is important to, after a long discussion about what the future policy might look like, to focus again on implementation, or continue the focus on implementation, governance, and communication to make sure that we actually harvest the potential for the improvements that we've identified and put into legislation. This will not come cost-free, we realize this, but then again, we think that both the benefits that are attainable, but also the funding that is available to do that, even at EU level, will make this easier to achieve. Because all of this will be money and effort that we can put to pretty good use. Thank you.